Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to the audio guide, Gout Myths Dispelled, The Systemic Truth, produced by the Global Healthy Living Foundation and made possible with support from Amgen. In this audio journey, you'll hear from experts Dr. Nissreen Elfadawy, a staff nephrologist at University Hospital's Gout Medical Center in Chardon, and Dr. Christopher Parker, co-founder of the Gout Support Group and lead rheumatologist for the Alliance for Gout Awareness. They'll help us grasp why gout isn't just about joints and why so many people fail to seek proper treatment due to common myths and misconceptions. Remember, this is not a substitute for professional medical care. Always talk to your doctor about issues concerning your health and medical condition. Let's start out by defining gout. Gout, often characterized by sudden and severe attacks of pain, swelling, redness, and tenderness in the joints, is commonly associated with the big toe. But what many fail to realize is that gout is not just a localized joint problem. It's a systemic disease with far-reaching implications for overall health. Dr. Elfadawy, what do we mean when we say gout is a systemic disease?
So let me start answering this question by telling you how the body handles the uric acid. That might help us to understand how gout is a systemic disease. So we eat varieties of food that can generate uric acid, and the only way to get rid of this uric acid is through the kidneys. So the kidneys get rid of it in the urine. Unfortunately, our kidneys are not designed well to handle uric acid. It's hard to get most of it out. So we end up with some uric acid hanging there in the blood. And this is normal. That's why normal uric acid is like 4, 5, 6, around this range. So when the kidneys don't handle this well, or if we have a lot of abnormal metabolism to the uric acid, we generate more than the capacity of the kidneys to get rid of it. So this is when we end up with built up in the uric acid. Uric acid are crystals. So when they are in excess in the blood, they just deposit everywhere and anywhere. Like anywhere, I'm saying anywhere. We hear a lot about the myth that uric acid is a joint disease, but actually this is not true. Joint disease is part of the symptoms that patients can feel when they have gout or hyperuricemia or high uric acid. But it happened that the joints are the most painful parts that the uric acid can deposit. So this is when exactly the patients seek advice. But I wanted to say that the uric acid crystals can go anywhere, like in the heart, in the kidney, in the blood vessels, in the urine. So having said that, uric acid can cause a lot of organ damage. And we have a lot of data actually showing that high uric acid and gout is a risk factor for the following. Count with me: early onset of type 2 diabetes, heart failure, coronary artery disease, chronic kidney disease, hypertension, metabolic syndrome. And a lot of times when we get kidney biopsy for a reason or another, we can see the uric acid crystals inside the tissue of the kidneys. So I tell my patients gout and high uric acid is like a room full of dust. You cannot control where the dust is going to go. It will just end up in everywhere, on everything in the room. So getting rid of this uric acid crystals from the body and wiping down the uric acid, this is the main target to treat gout. So again, treating gout is not just the gout flares or the attacks that happens 2-3 times a year. It's chronic management. It's taking care of the gout on the chronic basis even before the flares happen. So part of what we are trying to spread here is the concept is gout is not just a joint disease. Gout is not just flares. Gout is a chronic condition, exactly like hypertension and diabetes, and it needs chronic management. And it can affect every single system in the body.
Can you talk about why proper treatment can help prevent long-term complications and broader health effects?
So if we will talk about high uric acid management or gout, we will put it into 2 categories. The first category is lifestyle, so non-medical management. And the other category will be medical management. So let's talk about non-medical management or lifestyle. Most of us like to live a healthy life and eat healthier diet, but unfortunately, when it comes to gout, this is not the main part. It's good, we will talk about this and I will go over it, but this alone will help our patients. So something like limiting the food that comes with high uric acid, like red meat, steak, shrimp, lobster, shellfish, beer, wine, salt, sugar, fat. All this is good because, as I mentioned earlier, we eat food, we generate uric acid. So if we limit the food that generate uric acid, that might help. But to be honest, it will not help much. So we should not depend on this alone. Also, exercising, getting the blood pressure under control, diabetes under control, all this is good stuff, but it will not be the main cornerstone. It might help, but not the biggest help. So the biggest help is the medical management. If you talk to me many years back, I would say our options are limited. But actually now we have a lot of options. So let's start with the oldest options that we have, which is basically we can give the patient medication to decrease the rate they generate uric acid. So less production of the uric acid. This is one of the classes of medication like uric acid lowering therapy. We can give patients medication to make them get rid of the uric acid faster through the urine, which basically will make the uric acid go through the urine easier. This is another class of medication. We have the most recent class of medication, which are the biological infusions. Basically, these are infusions or enzymes that can help to convert the uric acid, which it's harsh to handle through the kidneys. As I mentioned, the kidneys are not well designed to handle all the uric acid. We cannot get rid of 100% of the uric acid through the kidneys because it's not water soluble. The uric acid is not easy to go in the urine. So those biological infusion basically are enzymes that can convert the uric acid into another molecule called allantoin. And allantoin is very easily can get released in the urine. So we can easily get rid of it through the urine just by converting the uric acid to another enzyme. So we have a lot of options. No one should get untreated. No one should suffer for a long period of time. No one should live with tophi. No one should live with disabling gouty arthritis. No one should lose their freedom because of such a disease. So please, message to all patients around, get help, ask providers, look for providers around. Don't let this disease get you. You got that.
So, if gout is indeed a systemic disease with such serious implications, why is it often dismissed or even trivialized? Here we talk to Dr. Parker about some of the myths and misconceptions that surround gout. So gout is painful but not serious. It's not a serious health issue.
That's obviously not true. Gout is a serious health issue. Yes, it's painful. It's painful intermittently often, but it's definitely serious. And to recap, these uric acid crystals that land in and around joints that cause all this pain can land anywhere in the body, including the major organs, impair organ function, and even shorten your life, depending on where those crystals are.
Great. And gout only happens to old white men, right? Have you heard of this one?
I have heard of that. And that's, of course, not true. But we certainly do think about the English kings and Benjamin Franklin and Thomas Jefferson. These are white men that got it in their older years, I understand. But here is the actual truth. Gout is the most common type of inflammatory arthritis in men. So once you get past normal wear and tear, if somebody has some other kind of arthritis, always think gout, because that would, and you'd be right statistically. It's way more common than rheumatoid arthritis or psoriatic arthritis or anything like that. Women are protected from gout during their childbearing age years because that estrogen that they're making from the ovaries has what doctors will say is a uricus-uric effect. And all that means is it tells the kidneys to release more uric acid. So they're getting rid of it better than men for as long as those estrogen levels are higher. But during their perimenopausal years and then menopausal years, those estrogen levels, of course, fall, and then women can catch up and do. And so that's any race. So it's not just white, any race, and men and women. But again, women have that protection. But if you said, Doc, are young women in your clinic with gout? I would say absolutely they are. They have estrogen levels that are high, right? I go, right. But they also have something else going wrong. Usually in my clinic, either they have sick kidneys. Now, the kidneys are the most important organ in the body to get rid of uric acid. 2/3 goes by way of kidney on average, and another third from the bowel. So if you go, well, if my kidneys are sick, they're going to have troubles getting rid of that uric acid. True. And so I have young women with little kids that have gout in my clinic, often have kidney problems. And then the other population is transplant patients, whether it's kidney or other. They have a lot going on and they can get gout too. Rarely would it be involved in kids. Think genetics there. I have a few teens with gout, but they're going to be the rare ones. But it's possible.
And now if you have gout and it disappears between attacks, then what, it's over?
So it's true that the attack is over. Not attacking you anymore. You don't have that pain. But if you said, are those crystals gone? The thing that's actually causing the attacks, are those gone? No. That's what's important to understand. You're just between attacks right now. And so if you have the false impression in your mind that just because the attack is gone, the gout problem, the high uric acid caused those crystals, is gone, you'd be wrong. And you are just a time bomb waiting for your next attack. And I like to remind people, especially when people come and say, I don't want to take an everyday medicine. I'm too young for that, right? And they go, well, think about spoiling your next vacation if you can't walk. Think about spoiling your wedding. Now, you may want to rethink taking a proactive approach, but I don't force anybody. I just give them the pros and cons. But all of that is case in point that just because you're between attacks does not mean you don't have a problem. The only way you know you don't have a problem anymore is if you get the data. And what I mean by that is check your uric acid level and make sure it gets to and stays below 6.0. It's got to be below there. Anything north of that, you're just waiting for your next attack.
Now, a lot of people think gout is my fault. It's because I ate too much shrimp or I drank too much beer. Can you talk about that and how lifestyle plays a part?
Yeah, you're absolutely right. I hear that all the time. And I completely understand, as a lifelong athlete, I beat myself up when my diet is not as good as it should be, right? It's very easy to do and say, well, if that was mine, I deserve that. But look around you. Is everybody who fudges their diet getting gut attacks? I mean, really, is that accurate? Is that a fair observation when you look around at the world? Answer, no, obviously not. Lots of people eat shrimp, drink beer or some other adult beverage with their friends or whatever. And so there's a lot more going on below the radar that you don't understand. All you know is you got trouble. So think of it like this. Check engine light comes on in your car. You're going to just keep driving it around and wait for the next thing to happen? That's not how I live my life. Check engine light comes on, bring it in, get it checked out. That's what you should do. And it's not all yours. Sometimes it's genetic. Sometimes it's not. Sometimes somebody's got a sick kidney or a sick something else, or they're on a medicine that actually increases uric acid levels. Is that possible? Oh, yes, it's possible. But if you don't know to look at that list to see what meds that you're on could increase uric acid levels, literally causing gout, you might not have to start a new medicine to fix it. You may have to subtract one to solve your problem. If you don't go get checked out, guess what? You'll never know.
And you touched on before that you can manage gout with diet alone.
I touched on you can't, right? That is a myth to think you can manage it with diet alone. And I'll tell you that, and what I like to share with all my patients, it's totally truthful, because I think that, if I'm really disciplined, that I can really maintain this austere diet that's low purine. And I'm sure that's going to work because I want to do this naturally. I get it. But the fact of the matter is that ain't going to work, because I have Olympic athletes in my clinic. I have professional athletes in my clinic. These are disciplined people. And when I start talking about diet, because I'm not saying diet's not important, it is. It's important to everybody, not just gout patients. It's important. But if I were to start saying like, oh, here's the things I don't want you to eat or drink anymore, they would look at me like I'm a complete idiot, because these are disciplined guys. They're like, you mean never? So I tell people, listen, be as good as you can with your diet. Diet is important. But the likelihood that you can make diet your only strategy to control uric acid is, in 25 years, never seen one case. Now, to be fair, if somebody really, really, really wants to try it, is it a problem to do it? I'd say no, but I'm not just going to wait and see what your next attack looks like. I say, I tell you what, why don't you be really assiduous at your diet? Be as tough as you can be. And how about you and I check your blood every few weeks? Let's just see how good you can be and get the data and act on it. Believe me, if you're my first one, we're both going to be happy. And I give them the time to do it. And I said, come back and see me in a few months. We'll have, 4, 5, 6 data points and look. And they come back and they look at the thing and then they know, ain't no way I can do this with diet alone. Don't feel bad about it.
Could you just talk a little bit to explain high purine foods and their role in gout?
Sure. Some foods will result in more breakdown to create uric acid than other foods. And those are called purines. Just think of it like a type of protein. So if you're eating more of those kinds of foods, they're going to get broken down to uric acid as well as other waste products. And if you're in the gout club, they can build up and cause you troubles. So what are those foods? Well, a lot of patients are frustrated because one list is not identical to another list. There's some debate on some of these food items, but here's where there's no debate. Alcohol, especially beer. Okay, just the way beer is made, there's lots of purines going in. Any alcohol can inhibit the kidney's ability to excrete uric acid, so double whammy for beer. Any alcohol, though, can inhibit the kidney's ability to excrete. And then you have organ meats. Again, there's no debate on this. Liver, kidney, brains. So those are going to have a lot of purines in them. And then shellfish tend to be high in purines. So those are all things you can watch for. And then there's a bunch of what I'm going to call yellow light foods, asparagus and stuff like that. And you kind of go, you're really going to cut me off asparagus? I go, no. I mean, those are also very good quality foods too. The last very important one that I want to reinforce, it is a complete myth to believe that if you're not having a flare-up, your gout's under control. The truth is, if you don't know the uric acid level in the blood, an actual number, you have no idea if it's under control.
To sum up what we talked about today, if you or someone you know is struggling with gout, remember this. Gout is not just a joint problem. It is a systemic disease with far-reaching consequences. By understanding the true nature of gout and dispelling the myths surrounding it, we can work toward better management, improved outcomes, and enhanced quality of life. For more information on managing gout, check out The Gout Show, available wherever you listen to podcasts. This audio guide was made possible with support from Amgen. And for more information about gout, download our free Patient's Guide to Gout, available on creakyjoints.org, which is part of the nonprofit Global Healthy Living Foundation. If you've enjoyed today's episode, be sure to subscribe to The Gout Show on your favorite podcast platform. And don't forget to leave us a review. Your feedback helps us improve and reach more listeners like you.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.